Hi, my name is Linda Stocum with Dermatology Times, and today we're going to do a special interview on hyperhidrosis in honor of November 2021 Hyperhidrosis Awareness Month. Would you first like to introduce yourself?
Sure. So I'm David Pariser. I'm a practicing dermatologist. I've been doing that for over 40 years. I'm in Virginia, voluntary faculty at the Eastern Virginia Medical School, where I'm a professor of dermatology there. And I've also been the president of the International Hyperhidrosis Society, as well as the American Academy of Dermatology, and many other things. But my day job is that I am a dermatologist, and I do lots of clinical trials helping to investigate and evaluate new medicines in pretty much all of dermatology.
So our first question is, what is the prevalence of hyperhidrosis?
So hyperhidrosis, which is excessive sweating, means sweating beyond what is needed for normal regulation of body temperature. And about 4.5% to 5% of the population of the United States has this condition that we call primary focal hyperhidrosis. Now, that's a little different from generalized sweating, which is something that may be caused by medications or by hormone or endocrine diseases or by neurological problems. But we're talking about today is primary focal hyperhidrosis, is sweating beyond what is needed for normal sweat, normal function of sweat, which is to cool the body. So areas such as the underarms, the hands, the feet, the face, or really any individual body areas, but not the whole body.
Does gender or genetic ancestry have any impact on how prevalent it is or the likelihood someone will get it?
So hyperhidrosis relatively equally affects men and women, relatively equally. Women more often come in for treatment because it's more of a problem for women than it is for men. It's more socially acceptable for men to sweat, but not so much for women. There is a genetic component to this. People who have hyperhidrosis, about 60% of them will have some family history. Now, that doesn't mean that if a mother or a father has it, that their children are going to have it. But 60% of the time that may be the case. I had a teenage patient one time sitting on my exam table. The mother was in the chair in the exam room, and I asked the teenager who was having excessive underarm sweating whether anyone else in the family had it, and she said no. And then the mother looked at him and said, "Well, honey, I never really told you, but I've had this problem all my life." And the teenager looked at her mom and said, "What, Mom, why didn't you ever tell me that? We never talked about it." And the mother sheepishly said, "And Grandma has it too." So it's not the kind of thing that people sit around the dinner table talking about. There's a lot of social stigma attached to hyperhidrosis. What people are viewed sometimes as being dirty or being out of shape or being obese or being unclean in some way. And so there is a real social stigma, but there also is a real quality of life problem in people who have it. People who have underarm sweating, excessive underarm sweating, may buy 3 shirts of the same size so they can change it 3 times a day and people won't notice when they used to go to the office. People who have sweaty hands will develop treatment, ways to try to hide it. So if they're at a cocktail party, they'll always be sure that they have an ice cold glass in their hand that's going to sweat in case they have to shake anybody's hand. So the wetness will be assumed to be from the glass. There are many, many stories like that, stuffing maxi pads in your arm, in the armpits of your shirt. So it's a severe quality of life. Students who smear their schoolwork because their hands are sweating and get disciplined for that, assumed to be sloppy. I had a policeman who couldn't fire his weapon because his hands were sweaty. I had a mother who dropped her baby on the floor because her hands were sweaty. It's a real quality of life issue. Now the people short out their computer keyboards if their hands are dripping. And above it all is this worry: when is the sweating going to start? When am I going to have this problem? And so it really does affect people's quality of life.
So when does the typical patient see this start? Is it a childhood disease? Does it start in adulthood? When does it actually begin?
So hyperhidrosis begins at a little different time based on the various areas of the body. Sweating of the hands often starts in childhood. And a lot of times, the first time mother or father will notice that is when they're holding their kid's hand to take them to the first day of kindergarten. And they'll feel that the hands are sweaty. Underarm sweating usually occurs during adolescence, around the time of puberty. And because of that, A lot of times, a teenager will go to their parents and say, Mom or Dad, my underarms are really sweaty. And the parents say, oh, that happens more to everybody when you go through puberty. It's nothing to worry about. Just don't mess with it. They may even get that same reaction from their pediatrician. So a lot of these teenagers end up going online and finding that they really do have a disease condition, and they may be the ones who bring it forward to the attention of their parents and of a healthcare provider.
And is hyperhidrosis chronic? Is there a cure? How does it work?
A long time, almost lifelong problem. I mean, and therefore it fits the definition of chronic, but we don't really use that term with it. A lot of people, when they get to be adults, if they've never sought any kind of treatment, they just get used to it and they live with it and they think it's normal and they don't know that there's any treatment available. That's the big problem. That's why we see that so many people with hyperhidrosis. There are as many hyperhidrosis as who have psoriasis, but dermatologists see much more psoriasis than they see hyperhidrosis because those people with excessive sweating don't really realize that there is help in a large amount of time. There are numerous treatments which are helpful, all the way from topical therapies to oral medications to injectable toxins. I can go into the details a little bit about these treatments because physicians really do need to know that these are available. First of all, in terms of topical treatment, topical treatments we usually start with the so-called prescription strength antiperspirants, which for mild cases of excessive sweating are helpful. There is a new preparation, relatively new, been on the market for a year and a half or so. It's a topical anticholinergic. Glycopyrronium cloth is the generic name for it. And this has been proven safe and effective for treatment of underarm hyperhidrosis. That's what it's FDA approved for, but we do use it in other body areas as well. That's a relatively new topical treatment. In the investigational pipeline, there are other new topicals. Another new topical anticholinergic will be around pretty soon, in the next year or two anyway, called soft pyrronium bromide. And then there are some devices, a thermal device, as well as some oral medications that are in the pipeline. There is no oral medication currently currently approved by the FDA for treatment of hyperhidrosis, but we do, as common practice, use systemic anticholinergics for treatment of it in body areas. Usually we reserve that when other treatments have failed or there are multiple sites that are affected. There's a device called microwave thermolysis or Miradry, which is FDA approved for treatment of the underarms. It's actually the only permanent treatment that we have. It works about reduction of sweat about 80%, which is pretty good for most people. That's the only real device that's currently out there, but there are at least one other device that's in the investigational pipeline. And then there's botulinum toxin or Botox injections, which are in many ways the gold standard of treatment because you can dry sweat in any body area that you inject with Botox. The problem with that becomes how much can you realistically do? Well, the cost is pretty prohibitive if a patient has to pay for it by themselves and needs it in any kind of large areas. But that really is a life changer, as are many of these other treatments for the patients who have severe problems.
But was there anything that you think that dermatologists need to know about this condition that I haven't asked about?
Well, unfortunately for the busy practicing dermatologists, the complaint of hyperhidrosis, of excessive sweating, tends to be what I call an oh, by the way. In other words, they're in for something else. And as the dermatologist is on the way out of the door with his or her hand on the doorknob, the patient's, oh, by the way. There are some other oh, by the ways too that all dermatologists can't wait not to hear. But this is something which really the patient may be hesitant to talk about. If you shake a patient's hand and find that it feels sweaty, if they're sitting on the exam table, you have a drape on them because you're doing a complete skin exam and you notice sweat dripping down from the underarms. Sure, maybe it's just that they're nervous, but you at least ought to ask about that. If they leave a sweat puddle in the floor where their shoes were, or you look and see that shoes are wet, patients will really be most gratifying if you are able to help them with this. In fact, the only two kinds of letters I get from patients are either complaint letters, which are few, or happy letters, from patients with hyperhidrosis how much I've improved their life.